Hello nurses, in today's session we are going to learn what an ECG is and how we can read an ECG for the diagnosis of various disease conditions of cardiovascular system. Welcome to Nurse Talk and my name is Surya. An ECG is a test that checks the electrical activity of your heart. So in a previous video we have mentioned about the cardiac conduction system and in detail we said there is SA node, AV node, bundle of His and Purkinje fibers which transfers the cardiac impulses and helps in the contraction and relaxation of the heart. So the ECG is a record of electrical activities of the cardiac cells. So the ECG actually record the impulses transferring to the cardiac muscles and thereby it helps us to understand if there is any delay or any issues in the cardiac conduction system or in the contraction and relaxation of the cardiac muscles. First thing we need to remember when we learn about ECG is ECG was invented in 1895 by William Einthoven. So remember the name, William Einthoven invented ECG in 1895. The ECG has actually, I hope you all might have seen an ECG even once in your life. ECG in total has 10 leads. 10 leads. Among the 10 leads, four of them are limb leads. Limb leads, the leads are attached to our arms and legs or the limbs. They are called limb leads and 6 of them are the leads we attach to the chest of the patient or it's called chest electrodes. We have limb electrodes and chest electrodes. 4 of them are limb electrodes and 6 of them are chest electrodes. Coming to the limb electrodes, we have right arm. For right arm it is red colored electrode and right leg it is black. Left arm is yellow colored and left leg is a green color electrode. So we have total 4 electrodes going to the 4 limbs of our body and then we have chest electrodes, the number is 6. See the chest electrode, I have given you an image in here which shows what are the positions we are going to stick the electrodes in the chest of the patient. So see the V1 and V2, the V1 and V2 are called septal electrodes. The V1 and V2 lies on the 4th intercostal space of the patient. This is the 4th intercostal space of the patient on the left and right side of the patient. Left side of the patient respectively. So V1 and V2 are in the 4th intercostal space and they are also known as the septal electrodes. Now we move to the V3. Remember, the V3 lies between V2 and V4. The position of the V3 is midway between V2 and V4. And the V4, V5, V6, as you can see in the image, all these 3 electrodes are in the 5th intercostal space. V1 and V2 are in the 4th intercostal space. V4, V5 and V6 in the 5th intercostal space. So, what is the difference here? The V4 in here, you can see this line in here and a clavicle. This is our clavicle bone. This is the clavicle of our body. So the V4 lies in the mid-clavicular line. This is the clavicle and this is the mid-clavicular line. V4 aligns with the mid-clavicular line and V5 is to the left side of the anterior axillary line. This is anterior axillary line and it goes to the left side of the anterior axillary line and V6 is in the mid axillary line. V6 is in the mid axillary line. Remember, ECG has 10 leads. 4 of them are the limb electrodes and 6 of them are the chest electrodes. The limb electrodes goes to right arm, right leg, left arm and left leg. The chest electrodes goes to V1, V2, V3, V4, V5, V6. Among that, V1 and V2 are septal electrodes and they are in the 4th intercostal space. So we said this is septal electrodes. That means it is beside the sternum. This is the sternum of our body and it lies on the right and left of the sternum and this is called septal electrodes. And V3 and V4, when you look at the person, we can see this is the front portion of the person. So V3 and V4 are in the anterior part of the body. They are called anterior electrodes. V3 and V4 are anterior electrodes and V5 and V6 which actually moves towards the left side of the body, it is to the side, so it is called lateral electrodes. Okay, so So what are the septal electrodes? V1 and V2 are the septal electrodes. They are on the fourth intercostal space between on the right and left side of the patient. These are septal electrodes. And to the anterior of the patient, V3 and V4 are anterior electrodes. V5 and V6 are lateral electrodes. And also remember the space where they belongs to. That is in the V1 and V2 in the fourth intercostal space. V3 is between the V2 and V4. V4, V5, V6 are in the fifth intercostal space, but V4 is in the mid-clavicular line, and V5 is in the left anterior axillary line. V6 is in the mid axillary line. So this is where we place the electrodes on the chest of the patient in order to assess the electrical activity of the heart. Okay, so a few points to remember in this area. That is, the ECG was found by William Endover in 1895. Total number of leads is 10, 4 limb leads and 6 chest electrodes. Okay, now we'll move to the image of an ECG. Okay, I am sure that all of you might have seen an image of an ECG at least once in your life. Yes. So what is an ECG? You can see in an ECG there are total 3 waves. First one is the P wave, and then this is QRS complex and a T wave. To be honest, in some ECGs there will be a U wave, and I'll tell about U wave later. Okay, so here we are going to discuss a normal ECG where we have a P wave, QRS complex and T wave, and the space between between the P wave and the starting of QRS complex is called PR segment. See the PR segment. Sorry, and thus from the starting of P wave to the starting of QRS is PR interval. Okay, and then the QRS complex, and from the ST segment to the T wave is ST segment, and from here from the starting of Q wave to the end of T wave is QT interval. So for the MCQs or for different types of examination, what is the most important thing in this image is the time they are taken for each ECG wave. So that's a very, very important thing. So remember, for a P wave, the time interval is 0.06 to 0.12 second. 0.6 to 0.12 second is the time taken for a P wave. This for just for this P wave. And then the QRS complex, it takes 0.04 to 0.12 second. The QRS complex here takes 0.04 to 0.12 second, and comes the T wave. The T wave takes 0.16 second, and the PR interval in here, it takes 0.12 to 0.2 second, and the QT interval in here, it takes 0.31 to 0.38 second. So among this, the most important thing is the time taken for a P wave, QRS complex and PR. These three has been asked in many questions. Okay, so remember, how are you going to study this? So P wave is 0.06 to 0.12. You have to by heart it. 0.06 to 0.12 for P wave, and QRS. See, when we look at an ECG, the most prominent or most seen part of the ECG is this QRS complex. But this takes the lowest time. 0.04 to 0.12 second. Remember, QRS takes the least time, 0.4 to 0.12 second. That's how I by hearted this thing. Okay, P wave, yeah, I by hearted it like totally like 0.06 to 0.12 second, and QRS looks like a bigger one, but it will only take 0.04 to 0.12 second, and that is the least time in the ECG. And T wave take 0.16 second, and PR takes 0.12 to 0.2 second, and the QT takes the most time, 0.31 to 0.38 second. QT takes the most of the time in an ECG, and next and 0.12 to 0.24 PR interval. So we have to learn it by heart, like we have to read it and make sure that you remember it all the time. Okay, so I'll tell that numbers again so that you won't forget. First one is P wave. When I say the number, I will just explain what these waves are to. Okay, so the P wave of an ECG. The P wave of an ECG shows atrial depolarization. Remember, it is atrial depolarization. When we were discussing a question paper of previous year, there was a question. It is in the video in my channel. There was a question that in an ECG, what does the T wave represent? That was a question, and I have explained the answer as well. So I'm telling it because it is very important to know the name of what it depicts in an ECG. So the P wave is atrial depolarization. P wave is atrial depolarization, and the QRS is ventricular depolarization. QRS is again ventricular depolarization. Remember, atrial A. First one is atrial depolarization and ventricular depolarization, and the T wave is ventricular repolarization. So this was asked in a question paper, the previous question paper. So question was, what does a T wave depict in an ECG? The answer was ventricular repolarization. So remember, the P wave shows atrial depolarization. When QRS complex shows ventricular depolarization, and then the T wave shows ventricular repolarization. And the time taken for each wave is P wave takes 0.06 to 0.12 second. QRS is the most seen part of the ECG, but it will only take 0.04 to 0.12 second. Then the T wave or ventricular repolarization takes 0.16 second. PR interval takes 0.12 to 0.2 seconds, and the QT takes most of the time in an ECG, that takes 0.31 to 0.38 seconds. So you have to remember all these numbers in detail, so that when you get a question, like the question was asked once, like what is the time taken for a P wave in an ECG? That was a question asked once before. So the answer was 0.06 to 0.12 seconds. So that is the answer of that question. So remember, you have to remember all these numbers in case if that comes up in an MCQ examination. Okay, so that is what an ECG looks like, and this is the different things happening in an ECG. Now we go to what happens. What is actually depicted in an ECG. We already said in an ECG we have a P wave and then a QRS complex. Excuse my drawing. And a T wave. P, Q, R, S, T wave. Okay. So this is an image of ECG. Remember, the impulses of the heart, or for the contraction of the heart, the impulses are generated in SA node, moves to the AV node, and then to the Purkinje fibers. So then to the bundle of His, and then to the Purkinje fibers. If you haven't watched the video of cardiac conduction system, I would please request you to go and watch it again. Watch it before seeing this video. It will be more useful for you. So the SA node, AV node, bundle of His and Purkinje fibers. This is the way where the cardiac impulses transfer from the right atrium and helps in the contraction of the heart and relaxation of the heart. So when a SA node, in the SA node, when a impulse is generated, and that is called atrial depolarization. So this atrial depolarization, or the P wave in here, shows a potential, action potential is created from the SA node in here, that is the atrial depolarization, and the atrial began to contract here, and then come to the PR segment. This is the PR segment, P to R. This is the PR segment. And what happens in the PR segment? The action potential then arrives the AV node. During the PR segment, the action potential arrives in the AV node, and it slows down temporarily. So remember, when we were talking about the cardiac conduction system, I said from SA node to AV node, once the impulse reaches the AV node, there is a small time delay happens there. small time delay or 0.05 to 0.08 second happens in that AV node, and that is called AV nodal delay, and that time lapse is called AV nodal delay. This PR interval shows the AV nodal delay. That means it is giving some time for the ventricles to fill up the bloods, or it is giving some time to the atria to empty the bloods into the ventricle. So that is happening in the PR interval, PR segment. The PR segment, what happens is AV nodal delay, or the impulses from SA node reach the AV node, but the AV node is giving some time for the ventricles to fill up the blood. That is PR segment. And then the QRS complex in here, what happens here? The impulse travel down to the ventricle. From the SA node went to the AV node, and from the AV node the impulses is traveling down to the ventricles through bundle of His and to the right and left bundle and Purkinje fibers, and helps in the contraction of the ventricles. And the T waves, the last wave in here, it is a recovery wave. T wave is the recovery wave where ventricular repolarization occurs. We already studied T wave is for ventricular repolarization, and it helps in the relaxation of the ventricles, and the heart will go back to the same condition how it was before the heartbeat. Okay, so this is the PQRS T waves in the ECG wave. So the first one is P wave, shows atrial depolarization. Atrial depolarization happens because the SA node started producing the impulse. And then the PR segment means that impulse travel to the AV node, and the AV node is giving some delay or nodal delay. What nodal delay? AV nodal delay is the PR segment. Then the QRS complex. In the QRS complex, the impulses travels through the ventricles. From the AV node, the impulses are traveling to the bundle of His, and then from bundle of His, it is to the Purkinje fibers and help in the contraction of the heart. So that is the QRS complex. And then to the T wave. T wave is the recovery wave. It is the recovery wave, and what happens here is ventricular repolarization. Okay, that is the ventricular repolarization happens in the T wave. So this is what happens in during a cardiac cycle, and it is depicted on ECG in different waves, and each wave has different time sessions, and also it has different responsibilities. So what happens during each wave is different. So what will happen if there is a change in an ECG? Okay, remember this is a normal ECG. P Q R S and T wave. P Q R S T. This is a normal ECG. So in case if a patient has a depressed ST segment, what is ST segment? This is the ST segment. Imagine a patient has a depressed ST segment. It will be like here. P Q R S T. See that depression here? This is the depressed ST segment. If a patient comes up with a depressed ST segment, the diagnosis may be myocardial ischemia, NSTEMI. NSTEMI means it's a type of myocardial infarction. It is non-ST segment elevation. No, ST segment is not elevated in here. That is non-ST segment elevation myocardial infarction. And it can also be hypokalemia or hypomagnesemia. Remember what is hypo means? Hypo means reduction, is it not? So remember, if the ST segment is going down or a depressed ST segment, the patient might have a hypokalemia, hypomagnesemia, NSTEMI, that is non-ST segment elevation, a myocardial infarction, or myocardial ischemia for the patient in case of ST segment depression. So imagine if a ECG comes up on our system or on the graphic paper like short QT wave. How is it? P Q R S complex and T. P Q R S, and the T just originates very close to the QRS complex. This is a very short QT wave. In case if a patient has a short QT wave, short QT interval, the patient may have a diagnosis of hypercalcemia or hyperkalemia. Okay, calcemia means increased calcium level, hyperkalemia means increased potassium. K is potassium. Okay, so in case if a patient has a short QT interval, the patient might have a hypercalcemia or hyperkalemia or increased potassium level. Okay, imagine if an ECG comes up to you, shows widened QRS. Widened QRS. How does it look like? P, Q, yes, P, Q, R, S, T. Widened QRS. The QRS is very widened. In this condition, the patient might have atrioventricular block. Either atrioventricular block because it's taking more time for the ventricles to contract. That means they're probably atrioventricular block or left ventricular hypertrophy. Left ventricular hypertrophy. We already said the QRS wave shows the transfer of the impulses to the ventricles. So if there is an issue in the ventricles, that will be the ECG will be shown like in a widened QRS wave. Left ventricular hypertrophy and ventricular tachycardia. Ventricular tachycardia, hyperkalemia. Hyperkalemia means increased level of potassium, and hypermagnesemia. Okay, so if a patient has a widened QRS wave, the patient might have some issues with the ventricle, especially ventricle tachycardia or left ventricular hypertrophy. Otherwise, the patient will be having a hyperkalemia or hypermagnesemia, which result in the widened QRS wave of the patient. And the next one is prolonged QT wave. Prolonged QT wave. First, earlier we studied about the short QT wave. Now we are in the short QT wave. We said this is P, Q, R, S and T. This is the P, Q, R, S, T. Short QT wave. When that time we said that probably because the patient has a hypercalcemia or hyperkalemia. That probably is the reason for the short QT wave. Imagine if the patient has a long QT wave. P, Q, R, S. Imagine the patient's T come here. P, Q, R, S. This is the long QT wave. What is the reason? What probably is the reason? We said if the patient has a short QT wave, it is hypercalcemia and hyperkalemia probably. So in case if the patient has a long QT wave, the patient probably have a hypocalcemia, hypomagnesemia, myocarditis. Myocarditis means inflammation of the myocardium. Myocardium is the middle muscle layer of the heart is myocardium. We have mentioned it in detail in the anatomy of the cardiovascular system. So myocarditis, hypomagnesemia, hypocalcemia or myocardial infarction. MI or myocardial infarction. These are some of the conditions where the patient has a prolonged QT interval. So in case if for a central government examination, they show you an image of an ECG which has a prolonged QT wave and ask what probably is the condition of the patient, you can go with the myocarditis or myocardial infarction probably is a diagnosis of the patient. Otherwise, they will ask you the patient has came with a dyspnea or chest pain to the emergency department and you did an ECG for the patient and the patient has a maybe whatever either the patient has a widened QRS wave or a prolonged QT wave or a shortened QT wave. So for all these diseases, we have to learn what are the disease conditions showing up in different types of disease conditions of the cardiovascular system. So remember, for a prolonged QT wave, it is probably myocardial infarction or myocarditis or hypocalcemia. For a shortened QT wave, probably hypercalcemia or hyperkalemia. Okay, and remember I was saying you, there in some cases, the patient probably might have a U wave. T wave in here and sometimes it's a U wave comes. In case a patient has a U wave, this has been asked many times. So you are looking at an ECG of a patient and you can see a U wave on the ECG of the patient. What probably is the diagnosis of the patient? So in case a patient has a U wave, the diagnosis maybe is hypokalemia. hypokalemia or reduced potassium. In case the patient has a hypokalemia or reduced potassium in blood, the patient will come up with a U wave. This has been asked many times, very, very important. The presence of U wave in ECG shows hypokalemia of the patient, hypokalemia for the patient. And there is another very common question which has been asked coming under ECG is sawtooth ECG. Sawtooth ECG. Sawtooth means saw is like a weapon which used to cut the trees and all. It's a saw. So sawtooth ECG, this type of ECG. Sawtooth ECG is seen in which disease condition? This is atrial flutter. The sawtooth ECG shows atrial flutter. Okay, remember, very, very important. U wave is prominent in patients who is having hypokalemia, and sawtooth ECG is seen in patients with the atrial flutter. So I hope you got an idea about what ECG is and what is the different types of ECG and how do we do an ECG. Okay, we'll go back to it again. ECG or electrocardiography is used to assess the or to record the impulses traveling through the heart and thereby diagnose the patient with myocardial disease conditions. So ECG has total 10 leads, 4 of them are limb leads and 6 of them are chest leads. The 6 chest leads are V1, V2, V3, V4, V5 and V6. V1 and V2 are septal electrodes. V3, V4 is anterior electrodes. V5, V6 is lateral electrodes. V1 and V2 are in the 4th intercostal space. V3 is in the midline between V2 and V4. And V4, V5, V6 is in the 5th intercostal space, where V4 is the mid clavicular line. V5 is in the left anterior, V5 is in the left anterior axillary line and V6 is in the middle axillary line. So the ECG was invented in 1895 by scientist called or doctor called William Enthoven. He invented the ECG. And then we studied about the ECG wave. ECG has, this is the ECG wave. It has a P wave, QRS complex and T wave. Time taken for each wave is different. In the P wave, the time taken is 0.06 to 0.12 seconds. QRS takes only 0.04 to 0.12 seconds. The T wave takes 0.16 second. And then we studied about the PR interval. PR intervals takes 0.12 to 0.2 seconds. And the QT interval in here, it says 0.31 to 0.38 seconds. So we studied about the time taken for an impulse to travel from atria to ventricle. That is the time taken for an impulse to travel through the heart muscles. That is different. It's different on different parts of, it shows difference in different part of the ECG. So we studied about that. And then we studied about what all these things are. The P wave, we studied P wave is atrial depolarization. QRS shows ventricular depolarization and T wave shows ventricular repolarization. So, and I also mentioned that this question of T wave has asked many times. What is the T wave in an ECG depicts? That is ventricular depolarization. And then we studied what is happening in each part of the ECG. The P wave shows the SA node, the impulses from SA node traveling to the AV node. The PR segment is the AV nodal delay, that the impulses is giving some time for the heart for the filling up of the ventricles. That is AV nodal delay. AV nodal delay happens in PR segment. And then QRS complex. In the QRS complex, the impulses is traveling through the bundle of His to the right and left bundle branches. This is happening in the QRS complex, helping the contraction of the ventricles. And the T wave is the recovery wave. T wave is the recovery wave and happens ventricular repolarization. Very, 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 very important. Ventricular repolarization. This is what happens in an ECG. Then we studied about different disease conditions or what is happening in different disease conditions. First one we studied was depressed ST segment. Depressed ST segment. In case a patient has a depressed ST segment, PQRS T. This is an ST segment depression. It may be the patient has a myocardial ischemia or ST segment elevated myocardial infarction, or the patient has a hypokalemia or hypomagnesemia. This is ST segment depression. Then we studied about short QT interval. Short QT interval. That means QRST. T comes very, very close to the QRS complex, that is hypercalcemia or hyperkalemia. Then we studied about prolonged QT. PQRST. This is happening in hypokalemia, hypomagnesemia, also myocardial infarction. Very, very important. Myocardial infarction, myocarditis. All this is condition. The patient will be having a prolonged QT interval. Then we studied about the widened QRS complex. PQRST. Widened QRS complex, most of the time it is because of the ventricular dysfunction, maybe like left ventricular hypertrophy or ventricular tachycardia or hyperkalemia. Also in case of medication toxicity, the patient probably might have a widened QRS interval if patient has a medication toxicity, especially with a sodium channel blockers. So sodium channel blockers, if the patient has got a sodium medication toxicity of sodium channel blocker, that is the patient will show a widened QRS wave. Okay, and then we studied about the prominent U wave. In some ECGs, the patient might have a prominent U wave, and this prominent U wave is due to the hypokalemia of the patient, and then if the patient has a sawtooth ECG, that is atrial flutter. Okay, so this is more about ECG. I hope you got some idea about the ECG and what is a brief session of ECG. What is like a brief session of ECG. In case if you have any questions to ask, you can pop it in the comments. Thank you very much.